This is Robert Kraft, and I'm your host on SNN.Network. And joining me today is a familiar face. He wasn't on that long ago, but we're excited to have him back. It's Daryl Rebeck from LXGene Holdings. He's the co-founder and president of the company. It's a publicly traded company. I got two symbols for you: LXG on the TSX Venture and LXXGF on the OTCQB. Daryl, welcome back. Good to see you.
Great to be back.
It's great to have you as always. So, like I said, we last talked in early April 2020. I'm going to make my same bad joke that seems like forever ago, and really, I think it does. But the company's actually put out some news since then. Even just this week, we're recording this on July 16th, and so yeah, with that, let's get an update. What's going on?
Yeah, so I think last time we talked, we had pre-commercial design. We were putting it into the hospital and all those sort of things. And I think, right now has been a huge week for us in the sense that we did the final product launch, and we did that on Monday, I believe, or Tuesday. So that's a big accolade in diagnostics company, any company really, where, especially diagnostics, actually, where, you have your alpha, you have your beta, you have your pre-commercial, and then your commercial instrument is the final one that is the hardest to get to, where it's working. Everything is done. The design is done. You know what the box looks like, which you can see now on the website. You know the process to load the machines. You even know how the packages look and how to store them. So it's a huge accolade that's been 4 years in the making. And the thing that we really want to see, especially as investors, is, okay, I love all this potential of what this may be, but can you just get to the point and show me what the final product is? So that's been insanely exciting. It's incredibly validating to have your final design, which is the design you're going to sell. So we're moving into sales right now. Again, a lot of diagnostics companies, even other industries, it's the same thing. You could talk for years about almost getting there, and you're producing more and more different instruments, not the final, and you're kind of tweaking in the background, and it takes a long time. And the hardest part is, okay, this thing's ready to go. And we just did that this week, which is incredible. And it really changes the company from an R&D company, which is exciting, don't get me wrong. But this is where the real excitement begins. This is where you're moving into sales. We just hired 2 sales reps. Again, you don't do that until you're close, so that does solidify that part as well. But now you're getting into that really, really exciting point of getting into sales, getting the instrument out there, getting your exposure out there, really growing the company to a legitimate competitor in a marketplace that's desperately in need of new technology.
So then, well, firstly, congratulations. I mean, this is I remember seeing you guys present. I think we talked about this in the last interview back. I think it was in 2016 or something like that, right? And so to get from there to now, you're finally commercial. It just shows that we're a MicroCap channel. It just kind of shows, like, hey, these MicroCaps sometimes are R&D pre-rev. They take a little bit of time to get where they need to go. So since our last interview, you also announced that you had some pilot programs going on. So how did they go? And I'm guessing they went okay since we're now going commercial, correct?
Yeah, and that's sort of, we've done our food safety panels. We did a pilot program there, or beta placement. We did the veterinary diagnostics, which again, I think I said last time, there's some testimonials online that are they're glowing, but it really solidifies why that market's in need of this technology. And now we've done the human clinical side. So it's really part of the whole thing when you're presenting your instrument. And again, in those 4 years, you're showing markets you can use it. You're showing them how it benefits them. You're collecting the data there so that you can publish that and tell them how well it works, etc. And then again, that all gears up to your sales part, which is again the hardest part to be at and the hardest part to get to. So now that we've really mitigated the risks of the machine, now we go into the sales side, and already there's a lot of orders percolating. It's really picked up in the last 3-4 days, even, in the sense that, okay, now I can see what this is. I can see the size of it. I can see how it works. I get the whole aspect of everything, and the faith that it's there is there as well, for obvious reasons, because we've done all these things. So that's a very different company than it was in April even.
So also maybe let's tell the audience a little bit more about, in that last interview, as I always ask in most of the interviews at the very end, value catalysts and growth drivers,
right.
How is some of these announcements that you guys have been putting out, how is that really fitting into the vision that you had for 2020?
Yeah, I think, I hate to keep using the word, but it's that ultimate validation now where um, if you do invest in lots of small caps, which obviously your viewers do, and everyone's been super supportive, and we appreciate that, you understand that as long as you're making those strides, you have the faith that they'll get there at that point. And, not all people can do that, but, and there's a multitude of reasons why it might not happen. But so, it's been 4 years, and even since April, just, you're getting to those points where every news release lately has been another sort of check in the box of, wow, they're finally, and I shouldn't use finally, but it is, if you've been an investor for 4 years, even though that's remarkable timing, and we've done a ton of stuff, and the instrument might seem simple, but it's actually not inside. But so you're at this point now where you can go to the marketplace and get your traction, and you're attracting the interest of majors, you're attracting the interest of your verticals, your vet diagnostics, your food safety, et cetera, and because you have final design, now it's again, I'm overusing simple terms, but it's so true. It's that real product with a real opportunity to buy it, not just something where you're saying, we'll let you know when you can take a look at it and come use it and all that sort of stuff. So that has changed immensely in the last little bit. So all these press releases has been gearing up to the fact that here it is, it'll be ready for sale very soon. This is what it looks like. This is how much it can cost, all those sort of things.
So then, I mean, from what you can tell us in terms of demand, what sorts of indications are you getting demand for the analyzer? Is it mostly, hospitals looking for the analyzer to deploy for, COVID tests, or is it other tests out there that they're looking to use it for?
Yeah, I think, and we talked about this in April too, I believe, but I'll reiterate it. But the human clinical side is a $22 billion market, and it's one that we weren't going to do for a couple of years. And the reason why is a lot of diagnostics companies have high costs, and that market is very appealing because it's huge, and your payback on your test is a lot. So the price per test is a lot higher than ours, et cetera. So you're kind of limited to that market, even though it's a huge market. But now you're competing with the 80, the 120, the $300 billion companies, and it's a different market. Now that COVID's happened, testing is gone through the roof in terms of the need for it. B is the fact that with EUA clearance, which we're working on right now, you can get emergency use authorization on your machine a lot easier and cheaper. It's not this year process and $5 million to do a panel. It's going to be remarkably less than that, and it could take a couple months. Versus again the year and the back and forth, because the FDA is very difficult to work with, but I do appreciate what they do because they're the ultimate authority on whether something works or not. So that's really a bonus, for lack of a better word, for shareholders, because now we're going into that market as well, because the demand's so high, and because you can get authorization so much easier now, and because there's such a need and demand. Like when we're in Dartmouth right now, they have all the competitor instruments, but because tests are hard to buy right now and supplies are so low, they're ordering thousands of tests and getting 10s and 20s. And with our machine, you can load your own assays in and do testing the day you get it. So there's a big advantage to our machine. And all this has come to light lately, whereas for 3 years, we've been talking about open access and all these sort of things. And it was something that you kind of breeze over because it wasn't understood. Now people understand what that means, because if you have a ABC machine, I won't pick on anyone, and you order 800 tests and you get 20, the practitioner's going, well, this is not working, and they're holding that for their high profile customers, and then they're out again. So there is a massive demand there, no question. So we are getting a lot of interest on human clinical point of need care, and that is really interesting right now because everyone's testing. We have a cruise ship company we're talking to right now. We have point of care. If you think anywhere you go right now, people want to test, even their employees, they want to test, or you have, everyone knows there's testing everywhere. So that's a huge demand. But that said, I still want to go back to vet diagnostics and food safety, which were two industries that we called the low-hanging fruit. But those are industries with very limited competition. The two of those are worth $20 million together. And they're really in desperate need. If you look, the Food Safety Modernization Act was something Obama put in. They've just redid it as of last week, saying, listen, we need better testing for the food. We have to enforce this. We are working on enforcing this. We need new technology. We want to validate new technology, et cetera. So those are markets that are hard to enter for competitors because they can't get their costs down. But because their costs are so low, when food safety comes and says, listen, I'm only paying $24 for a listeria test, they kind of walk away and say, well, it's too bad I can't do PCR in that. We go, whoa, wait a minute. We can actually compete there. and give you an answer in hours, or an hour on the first test, because Listeria grows, so you have to test the different. Anyway, I won't get into that, but so something like that is we can do that as opposed to the day or two that they're waiting right now to wait for culture. So those industries are still in very large demand. We have a lot of interest from those industries, and I like to say that we're not unfocused, but where I think it's really interesting for us, especially as a shareholder, is when you look at a lot of diagnostics companies and they're just doing human clinical, you got to get a little nervous because that's the one vertical. It's very competitive. It's hard to get traction. And if you can't compete there, or if you're not different enough or advantageous over the other technology enough, they're going to say, it's okay, I got the BioFire machines, or I got the Cepheid machines right now. So, I might try one, but I'm not going to do it. So your traction there is very hard to get. And there's tons of competition. Right now, it's wide open, and that's very exciting for all diagnostics companies. But if that company is only going after that vertical and it doesn't work, then you're left with the diagnostic company that's struggling a little bit, et cetera. Whereas we have applications for all these verticals, water quality as well, aquaculture. We've talked to the head of aquaculture for the US. These are all things where we can be very competitive in, and we will focus on our main markets, which will probably be vet and human clinical right now and food safety. But it doesn't mean that we won't have one salesperson kind of looking at these other industries as well, because we are applicable there. So I think that plays into an investor's confidence that, I'm not going to get stuck in this thing if it doesn't take effect. Also, it plays into the role of, if this is a potential acquisition down the road, which we've always felt would be the exit, someone like, Thermo Fisher, for example, is going to come in and say, wow, we really like this for the vet sector because we can't get our costs cheap enough on a PCR device, especially in the clinic. But it also has all these other industries that we can, as a 14,000 employee company, really pursue in a heavy fashion. So that's a very exciting thing where we're not limited to one market. Our cost doesn't, make us only applicable to one side or another. Our ease of use is so it's so easy to use that you're not going to go to a vet, for example, like some other competitors, and say, collect the sample and put it in your mailbox is what you do for IDEX right now. Wait till 3-5 days. But if you use our machine, there's only 5 steps, and then you get your results. That vet's going to say, well, I don't want to do 5 steps. I'll put it in the mailbox outside. Our machine is literally collect the sample, put it in the machine, as opposed to putting it in the mailbox. So these are kind of things where, we've done all our research and market dives into all these things where we understand that we're going to these people with a solution that's a multitude of hundreds or 1,000 times better, but it doesn't come with higher cost or harder to use or any of these other things that are a hindrance.
So with that, I mean, that was a lot to digest there,
Yeah.
but I'd say, okay, for my last question, let's narrow the focus into, let's say, from what you can tell us, like 1 to 2 things that investors now should look for. We do these interviews every 3 months. So let's say the next 3 months.
Yeah. So I think right now you've got your sales team starting, you've got final design. So over the next 3 to 6 months, you're going to see purchase orders come in. Again, your ultimate validation of sales. You're going to see the sales channel being built. You're going to see more sales. The launch is in September in terms of when we're going to start selling. And you're really going to see a progress in the company in terms of going completely from an R&D company into a functioning sales and revenue growth company. And that's a point where you really become of interest to all.
That's good. You want to see progress, not progress. We want progress.
Exactly. No, exactly. And what people ultimately want is go sell these things. So, we're at that point. That's very important. We're gearing up for that, and we have the process in place already. So as investors, what you would look for to me now is the next step is, you got your sales coming in and you've got this thing getting out in the marketplace, and you're going to have, a lot of validation in that sense. And that's a really, really exciting time because it takes any doubt you had away.
Well, with that, where can my audience go and find everything they need to know about LexaGene?
LexaGene.com is a great website. We spend a lot of time on it. There's a ton in there. Go to the media section. We were written up in Forbes a couple times. Again, you can't pay for Forbes, so those are great pieces. The testimonial from the vet, I think, is a very interesting one because it's just such a strong recommendation, and it's really solidifies, what it changes, et cetera. And there's a ton of stuff on there. There's a how it works section if you're interested in how this thing works. And then there's also the launch video of the MiQLab, which is our instrument. That's really quick and easy, but you can get a gist of, you know, how the workflow works and what it looks like. So,
hey, not only were you featured on Forbes, you were on SNN.
Exactly. Well, that's the most important one.
Of course.
They're already subscribing. So
there we go. All right, man. Well, thank you so much as always for the update, and I look forward to the next one.
Awesome. Me too.